types. Either it is a primary myelodysplastic syndrome. This was a PGI and All India question, where you will see primary myelodysplastic syndrome when age is more than 50 years. So older age group. So this was the question in All India PGI exam. Second category of myelodysplastic is also known as treatment related MDS. After giving certain treatment, they will take incubation period of 2 to 8 years, and after 2 to 8 years they will transform into myelodysplastic syndrome. So this is called treatment related myelodysplastic syndrome. After giving certain treatment, alkaloid or topoisomerase 2 inhibitor, normal patient will be transformed into myelodysplastic syndrome, that is a 2 to 8 years of incubation period. So out of these two, which will carry worse prognosis? This is the MCQ. So remember, treatment related will carry worse prognosis. So worse prognosis is treatment related myelodysplastic syndrome. Another question which examiner is asking is a cytogenetic change. Cytogenetic change in MDS. So which is most common cytogenetic change in myelodysplastic syndrome? In pediatric age group, in adult age group, and overall. So these are three questions which examiner will ask you. So first I will tell you what are cytogenetic changes in myelodysplastic syndrome. So number one is monosomy of chromosome number 5, monosomy of chromosome number 7. Number 3 is a deletion of chromosome number 5. So remember, deletion is always denoted by 5 minus. 5 minus means deletion of chromosome number 5. Fourth one is deletion of chromosome number 7, 7 deletion. Fifth is trisomy 8. So these are various changes, cytogenetic changes in myelodysplastic syndrome. So this is what I was talking about when we were talking about AML associated with myelodysplastic syndrome. So whenever you see any of these cytogenetic abnormalities or chromosomal change in a case of AML, that will signify a poor prognosis. So MDS cytogenetic change in AML patient is a indicator of bad prognosis. So here in this case, question is which is most common in pediatric age group? Number 1. So remember, monosomy 7 is most common cytogenetic change in pediatric MDS. So remember this point, monosomy 7 is most common cytogenetic change. Most common cytogenetic change in pediatrics myelodysplastic syndrome. So this is 1 point. Deletion of chromosome 5. Remember, deletion of chromosome 5 is a most common cytogenetic change in adults also and in overall also. So this was the question in PGI exam, overall. So adults and overall both, it is deletion of 5 which is most common. So just remember this point. Many of the guys they are writing it is a monosomy 7. It's a wrong statement. It is a line of Robbins and it's a line of Vintrobe. 13th edition, they say that it is a monosomy 7 usually seen in pediatrics and females. But deletion of 5 is a most commonly seen in adults as well as overall it is the most common. So just remember this point, when they ask about this question, most common cytogenetic change in myelodysplastic syndrome, your answer should be adult 1. That is a 5 deletion. So this was PGI question. So these are cytogenetic changes. Pediatrics cases, most common monosomy 7. Adult cases, most common deletion of 5, and overall it is deletion of 5 which is most common. So as I was talking about myelodysplastic syndrome, what is a pathology in myelodysplastic syndrome? So it is a dysplasia of myeloid stem cells. So what I said, it's a dysplasia of myeloid stem cells. What are myeloid stem cells? Myeloid stem cells dysplasia means maturity defect. So there will be a maturity defect in myeloid stem cells. So what are these myeloid stem cells? Myeloid stem cells, it can be erythroblast, right? It can be erythroblasts. It can be neutrophil, number 2, and it can be megakaryocytes also. So these are 3 cells which are getting maturation defect. So maturation defect or dysplastic change in a myelodysplastic syndrome. One by one I will tell you and you will understand. These are all very important MCQ in exams. Erythroblastic cells, I am showing you erythroblastic cells here. This is the erythroblastic cells. This is a nucleus of erythroblastic cells, and just at the perinuclear area inside the mitochondria, what I am showing you here, inside the mitochondria, because of maturation defect inside the erythroblast, iron will be accumulated. So this iron will be accumulated or deposited inside the mitochondria. This iron deposition inside the mitochondria, they will provide a ring-like appearance around the nucleus, and this is called as ringed sideroblasts. Ringed sideroblast. Previous year All India question and DNB exam question this year. So ringed sideroblasts are seen in which condition? Myelodysplastic syndrome. Because of myeloid maturation defect, iron is not incorporated into protoporphyrin, and because of this, iron will remain as a ferric atom inside the mitochondria, and this is known as ringed sideroblast. So remember, ringed sideroblast is always a pathological entity. Ringed sideroblast is always a pathological entity, and they are seen in myelodysplastic syndrome. They will be seen in sideroblastic anemia and lead poisoning. So these are 3 conditions where you will see ringed sideroblast: megaloblastic anemia, myelodysplastic syndrome, and lead poisoning. So this is how examiner is asking MCQ. Ringed sideroblast number 1 is seen in erythroblastic lineages of myelodysplastic syndrome. This was an old AIMS question some 4 years back. Question was, in ringed sideroblast, iron is accumulated inside which organelle? So now you can see that inside the mitochondria. So that is why I drew this diagram. So it is the iron accumulation inside the mitochondria which is giving ringed sideroblast. So this is about erythroblastic lineages. When we talk about neutrophil, they usually have 3 to 5 lobes. So we have seen this in megaloblastic anemia discussion. Neutrophil normally have 3 to 5 lobes, but because of maturation defect, neutrophil will be having just 2 lobes like this. So this is a bilobed nuclei of the neutrophil. This is bilobed nuclei of neutrophil, and this deformity is called as, this was question in previous year All India PG exam and DNB exam with a diagram based question. I will show you the diagram also. So bilobed nuclei in a neutrophil, it's due to maturation defect, and this condition is called as pseudo, remember it is called as pseudo-Pelger-Huet anomaly. Pseudo-Pelger-Huet anomaly. So this is another name which examiner will ask you. Ringed sideroblast, second deformity is pseudo-Pelger-Huet anomaly. Number 1, ringed sideroblast, pseudo-Pelger-Huet anomaly. What is pseudo-Pelger-Huet anomaly? These are bilobed nucleus inside the neutrophil. Coming to the megakaryocytes. If you look at a normal megakaryocyte, remember, megakaryocyte, they are the largest cells in the bone marrow. Megakaryocytes, they are largest cells in the bone marrow. And their nucleus, they are syncytium-like nucleus. So they are all fused nucleus, syncytium-like nucleus. But because of maturation defect of myelodysplastic syndrome, now all nuclear lobes will be separate like this. all nuclear lobes will be separate like this. And what is this known as? This was a state exam question, an All India PG question this year. So what is this deformity where separate lobes of the nuclei, separate lobes of nuclei are seen? This is called as Pon ball megakaryocyte. So this is known as Pon ball megakaryocytes. So Pon ball megakaryocyte, separate lobes of the nuclei is called as Pon ball megakaryocyte. So this is third change in a myelodysplastic syndrome. So this is what I want to convey you in a MDS. So it's a very easy to remember. Don't get afraid of the name myelodysplastic. It's easy. Myeloid stem cell dysplasia means maturation defect. When we talk about erythroblastic lineage, rings of the iron granule will be formed surrounding to the nucleus called as ringed sideroblasts. Seen in MDS, sideroblastic anemia, lead poisoning. Number 1. Neutrophil, another example of maturation defect of myeloid stem cell, myelodysplastic syndrome. Bilobed nuclei called as pseudo-Pelger-Hewitt anomaly. Remember, Pelger-Hewitt anomaly is a autosomal dominant genetic disorder. It is not MDS. So in exam they may write like this: Pelger-Hewitt anomaly, pseudo-Pelger-Hewitt anomaly, which is seen in MDS. So always remember, it is a pseudo-Pelger-Hewitt anomaly. It is an acquired condition. Pelger-Hewitt anomaly is a autosomal dominant condition. This is a genetic disorder. So pseudo-Pelger-Hewitt anomaly is seen in myelodysplastic syndrome. And when you have separate lobes inside the megakaryocytic cytoplasm, then we say that it is a case of a Pon